was referred to Caring Medical by another person who's actually come here and had very good results. It was a shoulder injury where mine is really knees, but I was really impressed with the results that he got, so I decided I'd come down and check it out. I have 2 knees that are supposedly worn out, and so arthritis and some torn ligaments and things like that, and I was looking at the potential of having knee replacement, which I did not want to have. So this was my search for not having to have knee replacement.
And so far, what has Dr. Hauser told you about, what the treatment's going to be like for you?
They're going to use stem cells. I know there's several different types of treatments, but the idea behind what they want to do is correct the areas that cause my problems, which is to improve the ligament, the strength of the ligaments around my knees, and improve just the overall health of my knees. But it's all about repairing what caused it to happen in the first place.
Did you have an injury to your knees, or did it just happen over time?
Actually, it started probably about 15 years ago. I climbed Kilimanjaro, and coming down, I twisted my knee, and the pounding, actually people think going up is hard, but the coming down is actually harder than the going up. And the jamming of my knees, actually I had terrible knee pain when I came down from climbing. Mm-hmm. And after that, I was able to do less and less, running and things, in very slowly over the last 15 years. My physical activity has dropped significantly because of the pain in my knees.
It's very common for people to come to Caring Medical Regenerative Medicine clinics having already seen another stem cell clinic, and the reason why they choose to come to Caring Medical is primarily because our treatments are much more comprehensive. So in this patient's case, Rita, I'm going to demonstrate the typical exam that a person has with knee arthritis and what makes them a very good prolotherapy candidate. So Rita doesn't want to get bilateral joint replacements, right? So we see that for the most part she has pretty good extension, and then you have very good flexion. So your range of motion, you've lost maybe 20% of normal range of motion, but it's still actually pretty good. And the exam on the right knee is pretty much the same as the left knee. So in other words, you've lost a little bit of extension and you've lost just a little bit of flexion, but you still have relatively good motion. So those are 2 of the criterion that we look for to see if somebody's an excellent prolotherapy stem cell candidate. And the 3rd criterion, which you and I talked about, was, do you have ligament laxity? Do you have ligament laxity? So on physical exam, I can just feel that there's a little bit of extra give with this maneuver, and we're going to actually see that extra motion on ultrasound. The other thing that obviously we do on physical exam is to see, do you have tenderness? Do you have tenderness in the ligaments? And obviously, you have that positive jump sign. So you and I would suspect that on ultrasound, you would actually see the joint here open up, and more likely than not, you're going to have some ligament damage on this side and this side. So I'm now going to proceed to the ultrasound exam. The most common complaint that a person has with arthritis of the knee is actually stiffness. Like arthritis just causes a stiffness in the joint. But what most people don't realize is the stiffness is because of looseness of the joint. When the joint is unstable, the body swells the joint ever so slightly, and that's actually what the person feels as stiffness. The way we show a person that the knee is loose is by ultrasound. Now, by ultrasound, what we do is we find the joint line, and then we're doing a stressor maneuver. So what I'm going to do is actually show you how I do that on an actual person. So what I'm going to do is, I normally would obviously would face the ultrasound screen, so I'm actually going to go do that now. Okay. So we see on the screen Rita's medial joint line. So, and then Katie is going to point out a couple of bone spurs. So those bone spurs are the body's attempt to stabilize her knee. So it's actually the instability that's caused the breakdown of her meniscus and her cartilage. So we document the instability. You can see I'm not even putting that much of a stress, but you can see how the joint opens up. See how and the more I push, the more the joint opens up. It's actually that instability that's caused her meniscus to break down and her cartilage to break down. The missing cartilage and meniscus is because the cells have actually died. It's actually the destructive joint forces from this instability that's causing her cartilage cells to die. So prolotherapy and stem cell therapy into the injured ligament, the meniscus, the cartilage will cause those cells to proliferate and ultimately cause her joint to be stable on this side. And we can document the stability has returned by ultrasound.